Good evening. Today we are going to discuss about Hemophilus influenza pneumonia. Hemophilus species are oxidase positive. They are capsulated. Some are non-capsulated. These are pleomorphic, gram-negative bacilli. These are fastidious bacteria. They need special growth factors. These special growth factors will be present in the blood, such as factor 10 and factor 5. Okay. Hemophilus influenzae, which are most pathogenic species because they are causing pneumonia and meningitis in the children. And Hemophilus ducreae, which is causing sexually transmitted diseases. That sexually transmitted disease is concroid, and patient usually present with genital ulcer. Hemophilus aegypticus, it causes conjunctivitis and rashes. Hemophilus hemolyticus and Hemophilus parahemolyticus, they produce hemolysis, so they are named as such. Okay, hemolysis on the blood agar. They are also present as commensals in throat or mouth. Hemophilus aprophilus and Hemophilus paraaprophilus. These are renamed as aggregaticans aprophilus and aggregaticans paraaprophilus. This will cause infective endocarditis. Hemophilus parainfluenza can cause infective endocarditis. History: Hemophilus influenza, which is also known as Pfeffer's bacillus, because it is discovered by Pfeffers. Okay. Virulence factors are capsular polysaccharide, which inhibits the phagocytosis because these lysosomal enzymes can't lyse this capsule, and it is major virulent factor. Okay. Other virulence factors are bacterial endotoxin. Endotoxins are usually produced by gram-negative bacilli, means gram-negative bacteria, whether it is cocci or bacilli. So we'll expect endotoxin only, and outer membrane proteins are usually present in gram-negative bacterial cell wall, and IgA proteases, pili and other addition proteins, which are also the major virulence factors. Serotyping based on the capsular polysaccharide only. Serotypes are derived. These serotypes are from A to F. Strains which lacking the capsule are called as non-typable strains. Hemophilus influenza serotype B. It is most virulent among all types and accounts for most of the invasive infections. Hemophilus influenza B capsule, it has unique chemical structure. It is made up of polyribosal ribitol phosphate antigen. So it is strongly immunogenic. It induces IgG, IgM and IgA, and these are bactericidal, opsonic, okay, and protective. Okay, and this polyribosal ribitol phosphate can be used in the preparation of vaccines, and so that we can prevent this Hemophilus influenza B. And now there is decreased cases of Hemophilus influenza B. And next to Hemophilus influenza B, non-typable strains which are most commonly isolated clinically. Other capsular serotypes are very rarely isolated. Okay. So we must understand the differences between type B and non-typable Hemophilus strains. Capsule in the type B strains, which is made up of polyribosal ribitol phosphate, and in non-typable strains it is non-capsulated, right? Manifestations are we already talked this: meningitis and epiglottitis and pneumonia, bacteremia. So it is very dangerous. It may cause acute respiratory manifestations like okay, did you understand? Epiglottitis is involved, means some respiratory tract will be affected. Okay, and most dangerous these type of manifestations. And non-typable strains, otitis media, which is present in the children because middle ear is affected, so otitis media will be occurring, and pneumonia in the adults. Okay, commonly affect type B strains will commonly affect the children, and non-typable strains commonly affect the adults. And hematogenous spread, which is seen in the type B strains, contagious spread, which is seen in the non-typable strains. A vaccine is available for Hemophilus influenza B strains, and no vaccination for non-typable strains. So non-typable strains are increasing nowadays. Cases are increasing. Okay. So did you understand the differences, guys? So let's start further. Okay, what are the clinical manifestations? How the patient with the Hemophilus influenza type B will present. So Hemophilus influenza B causes systemic disease, and it is most common, and by invasive and hematogenous spread. from the respiratory tract to distant sites such as meninges, bones and joints. CNS manifestations will be pyogenic means pus will be there, meningitis means inflammation will be there in the meninges, and subdural dura will be affected. Okay, dura meninges layers on dura, arachnoid and pia. So outermost dura is affected, and subdura also affected. So subdural effusion will be occurring. Mortality rate which is high if untreated. Epiglottitis, inflammation in the epiglottis. Uh, okay, cellulitis of the epiglottis, and supraglottic tissues will be occurring. It is a life-threatening disease because epiglottis is involved means airway path, it will be involved, so airway obstruction will be occurring, so it is life threatening, and it affects typically older children like 2 to 7 years old, and rarely adults. In case we are taking cases, right, history taking, this is important. We should ask for the age, and we will rule out whether it is Hemophilus type B or Hemophilus influenza non-typeable strain. Okay, we can rule out 2 to 7 years old infant, old children, sorry, if they are infected, it is and they will, if they are present with meningitis or epiglottitis, we will rule out, we can rule out. Okay, community acquired bacterial pneumonia. Hemophilus influenza B will cause pneumonia in the infants. So pleura will be in pleural environment will be more commonly seen with this Hemophilus type B than in any other cases. Okay, in any other Hemophilus species, Hemophilus type B will be more commonly present with pleural involvement of pneumonia. Okay, parameningeal focus of infection present often in the adults such as sinusitis and otitis. Infection spreads to meninges. Sinusitis, normally which sinus will be affected? Maxillary sinus will be affected. Okay. Less common invasive manifestations include cellulitis of the neck and head region, osteomyelitis, septic arthritis. Septic, any bacterial environment there. Sepsis means infection, right? So bacterial infection is causing septic arthritis. Joints are involved. Joint pericarditis. Okay, pericardium is involved, and emphysema and bronchiectasis, orbital cellulitis will be occurring, endophthalmitis which is occurring, urinary tract infections, and bacteremia without identifiable focus. Okay, non-typeable Hemophilus influenza, it is it causes disease by local invasion of the mucosal membranes, okay, mucosal surfaces, and childhood it is presented with otitis media, sinusitis in children and adults, uh, puerperal sepsis and neonatal bacteremia, and non-typeable strains which usually colonize the female genital tract, exacerbations of COPD, community acquired bacterial pneumonia in adults with underlying COPD or AIDS. Rarely they cause invasive infections. Okay, what is the epidemiology? Risk factors are household contact, daycare centers, and if there is no spleen infections, because it is secondary lymphoid organ, right? If there is no spleen, then mostly the persons will get affected. On socio-economic conditions, rural area people will be mostly affecting, and genetical differences. Incidence Hemophilus influenza B is decreasing now because it has vaccine. Non-typeable are mostly nowadays, most cases are non-typeable strains, and hosts are usually humans. Okay, and mode of transmission is droplet inhalation, contact with infected secretions or fomites. Okay, what is the laboratory diagnosis? According to the site of infection, we will collect the samples, sputum, blood, and CSF. In case of meningitis, we will collect CSF. Okay. Process it immediately. We should process, and we should not refrigerate. If we refrigerate, the bacteria is highly sensitive to low temperature, and it will get die. No use. Our test will show like negative. and okay. And direct examination, pleomorphic gram-negative coccobacilli will be seen on gram staining, and capsule detection by Quilling's reaction. What we will do for detecting capsule means we will take that CSF sample and we will add methylene blue and we will check further. Okay. Antigen detection by latex agglutination test, direct immunofluorescence or ELISA. Okay guys, and culture blood agar with Staphylococcus aureus, because Staphylococcus aureus will produce NAD, which is required, which is a factor 5, which is required for the growth of Hemophilus influenza, and it will show satellitism. Satellitism means perpendicularly this Hemophilus influenza grow on the to that of the Staphylococcus aureus, because this Staphylococcus aureus will be producing NAD, and near to the Staphylococcus aureus colonies, they are big growth of this Hemophilus influenza, and farther, because the low availability of NAD, there is less growth. Okay, I will show the pictures also now. Others will be chocolate agar. Other cultures will be chocolate agar, because chocolate agar, this blood agar will heat it, right, and this RBC will get lyse, and intracellular presence of NAD there, not there, right. This NAD will be coming outside, and NAD is the factor 5 which is required for the growth of Hemophilus influenza. So this chocolate agar will be useful in growing Hemophilus influenza without need of Staphylococcus aureus also. And flight agar and Levathal agar are special culture. Okay. Identification, we will do disc diffusion, disc test for 10 and 5. Okay. Hemophilus ducrei, they want 10th factor, and they won't grow on the 5th factor or 10 5. Okay. And Aprophilus species will need 5th factor, they won't need 10th, so they will grow along the colony of they will form colony around the 5th factor. Okay. Automated systems such as Malitov or Vitek, whereas Hemophilus influenza can need both 10th and 5th, so it will grow on 10th 5th surrounding it will form around 10 5th factors. Okay. Typing methods are biotyping and serotyping. Usually specific anti-sera will be needed. Molecular methods are multiplex PCR, biofluorescence, detecting common agents of pyogenic meningitis in CSF. Antimicrobial susceptibility test is done.